Welcome to Menopause Made Easy Part 4. This video will be about hormone replacement therapy. The following words will be taken from the clinical practice guidelines on hormone therapy during menopause in Malaysian women, issued by the College of Obstetricians and Gynecologists, Academy of Medicine of Malaysia. And it reads, each woman should be counseled on the current data regarding the risk versus benefits of hormone replacement therapy in simple terms. Inform about their potential side effects and any special concerns applicable to her particular situation before starting hormone replacement therapy. One should also take into account the woman's own preferences and expectations. Only after this can the woman make an informed individual decision on whether or not she would want to take hormone replacement therapy. The main task of hormone therapy, or HRT, is obviously estrogen. Estrogens in clinical use include those that are synthetic as well as those that are natural, like conjugated equine estrogens taken from female horse urine. Most common routes of administration includes oral, which is cheapest, transdermal estrogen patches, gel that can be applied to the vagina locally, and as well as implants of estrogen. Progestogens are also used. There's several types, and they are used in combination with estrogens, either sequentially combined or continuously combined, and you can ask your gynecologist more about this. Hormone therapy can be started when you are in a perimenopausal period as well as the postmenopause period. It depends on your gynecologist and your decision, but generally if you have an intact uterus, you need estrogen in combination with progestogen to prevent endometrial cancer. But if you do not have a uterus anymore, only estrogen is required. Benefits. Short-term benefits includes the relief of vasomotor symptoms like hot flushes, insomnia, tachycardia, and also relief of urogenital atrophy. Long-term benefits, prevention and treatment of osteoporosis is well founded, unlike the effects on the central nervous system, which is contentious, as well as prevention of cardiovascular disease, reduction in macular degeneration, and it protects against colon cancer. Short-term benefits, this is a 6-month crossover study of hot flush count with estrogen or a placebo. In the blue is the estrogen arm. From day 1 to month 3, the amount of hot flushes per week drops. Like when you switch these patients to placebo, the amount of hot flushes increases. In the red arm is the placebo arm. From day 1, they started taking the sugar pill or placebo, but they still think they're taking something, so they have decreased amount of hot flushes per week. But when you switch them to the real stuff, the estrogen or HRT arm, it continues to drop further. And effects of estrogen treatment on lower urinary tract symptoms. You see general improvement of urinary tract symptoms with HRT, like urinary frequency, nocturia, stress incontinence, and urgency after 3 months of estrogen therapy. Mammary or breast cancer is the most common cancer in Caucasian women. As you can see, with age, there's an increased prevalence risk. Bone mineral mass in a 3-year crossover study. The loss of bone is inhibited only after a switch from placebo to HRT. As you can see in this blue arm, with time, down to 24 months, the bone mineral mass drops. But when you switch these patients to estrogen and progestogen arm HRT, the bone mineral mass increases. Bone mineral mass after calcium alone or calcium with HRT. Vertebral bone mineral and femoral bone mineral. In the blue arms of both measurements, if you take calcium alone, the bone mineral mass still drops. But if you take calcium with HRT, the bone mineral mass increases. So in conclusion, calcium is ineffective with the absence of hormone replacement therapy, especially in early menopausal age. And it's also helpful against tooth loss. Effect of HRT on the survival rate in cases of coronary artery stenosis. The survival rate of postmenopausal women with angiography verified critical stenosis of coronary arteries was always higher in estrogen users than non-users. So in the red is the survival rate of estrogen users, HRT users, versus in the blue, the survival rate of non-users. Effect of HRT on the risk of Alzheimer's disease is less, but estrogen also delays the onset of Alzheimer's disease. HRT and the risk of colon cancer, it confers a protection, and the relative risk of colon cancer is reduced. It's much lower compared to non-users. Mortality rate in women with age, coronary artery disease, death-related increases, as well as breast cancer and lung cancer. Protective effect of estrogen, it improves the cholesterol metabolism, it affects the cardiovascular dynamics by restoring the endothelial function of the blood vessels, thereby increasing cardiac output, increased arterial flow velocity, as well as decreases vascular resistance. And it affects the fibrinolysis. Overall, studies of ERT or HRT on cardiovascular disease. There's a lower risk of cardiovascular disease with HRT versus no HRT. So on the next video, I'll be talking about the risk of hormone replacement therapy. So thank you for listening. See you.